we have to present them with the price 3 times on 3 separate dates in order for them to present you with the Platinum American Express, which is like a soft kiss on the salesperson's cheek. That's my analogy. I do have a talk that goes along with it. We're going to talk about key concepts in presenting fees, and I definitely feel very differently about presenting fees than almost anyone I've ever met, which may mean that this speech will be very well taken or maybe raise some questions. My theory is that this presenting of fees is something that is done right in the beginning, and the sale is already done before you ever meet the person, and everything to me is moved forward and moved up. So I'll kind of run you through my concepts on this. Just so you know where we're coming from, we actually manage practices every day that are actually selling in offices every day in all kinds of cities across America. Our average YellowTelescope patient advisor currently sold over $2 million individually. 2 of them sold over $3 million last year individually for the same practice. So that makes it a big practice. That's just one surgeon doing surgery. And we do have very high close ratios, and we do pretty much sell top dollar surgery, very expensive stuff. So we feel like anything under $250,000 a month for any individual salesperson probably is not doing fantastic. So we're definitely getting results. The most important part is really what's happening pre-consultation. We believe that by the time you get off the phone with the prospective patient the very first time, the sale's over. Everything else is gravy. If you haven't nailed the pre-consultation call, in our opinion, you're missing out on business. Most salespeople who are either not comfortable at the end of a closing, or in general are not comfortable salespeople, feel that way because they don't believe in the product, which is a completely different speech, and we're assuming you believe in your doctor and you do good work, or B, they're presenting information that's new when it should be old news. So we're all about presenting information at the closing that's old news. So this is where the surgery is sold. The sale is over before the call ends. In our offices, the receptionist transfers the call to a patient coordinator, advisor, salesperson, never the doctor and never just the receptionist. And our highest level, most highly paid people take all incoming phone calls when they're new prospect patient calls. We then do an introductory call. I will do my version of it. Thanks so much for calling. This is John. How can I help you? Great, I can go ahead and help you out with that. Let me go ahead and get some information. I can go ahead and set you up for an appointment. Name, address, phone number, email address, source, etc., etc. Great, let me go ahead and find a time that's that works for you. Fantastic. Doctor's taking a lot of time out of his busy schedule to meet with the person, so I want to make sure this works for sure before I get you set up for this appointment. That definitely works. That's wonderful. You can go ahead and make a note in your iPhone or your calendar to keep your appointments, and that would be fantastic. To finish up, I had a couple of quick pieces of information to share with you. First of all, and we're going to trial close, present price range and get time frame. On the phone to begin with, and I know a lot of doctors are anti-giving out prices by phone. My attitude is you have to give the price even if they don't ask. That doesn't mean you give them the exact price. You don't say, our rhinoplasty is $8,000, take it or leave it, otherwise don't show up for your appointment, ma'am. That's not effective. I did not say to do that. Don't tell your doctor. What we are saying is to give a broad range, something that includes the people who might spend way, way higher, but also something that will include the people who spend quite a bit lower, so you don't lose that person who is considering a rhinoplasty but may want some different fillers, but still a range so that they have an idea. So I'll say, Barbara, before I let you go, a couple of quick pieces of information you may want to know. In general, a lot of people wonder about prices, and I'm sure you're wondering as well, and I obviously can't tell you anything exact. I just don't know yet. But to give you a range, these procedures might range anywhere between around $4,500, maybe as high as around $10,000 or $11,000. The vast majority aren't that high and aren't that low. A lot of them are in between. You see a lot of 5, 6, 7s, 8s, but that at least gives you some sort of range. Now, based on that, and just on the basic information I've given you, and I already told you that Dr. Smith is, the world's greatest doctor for X number of different reasons. You've seen our gajillion photos and everything else. Don't actually say that. Insert real facts. Based on that, and here's the trial close. So we've now given them a broad range that's not going to weed out people who are just a little bit light, maybe good with care credit or other finance options, and it's not going to weed out people who might want to spend quite a bit more. We're now going to say the trial close. Out of curiosity, assuming you like Dr. Smith, and assuming that you're comfortable with everything, do you have kind of a time frame in mind as to when you're kind of hoping to have the procedure based on your schedule? Well, I'm hoping ASAP. I mean, I guess, I don't know. Great. We just closed the sale. It's over. It's done. Everything else is just getting them to show up, making sure the doctor doesn't punch them in the face, making sure you don't give them a price quote that was 10 times what you said it was going to be, and the sale is over. We've done it in a nonchalant, positive way. To me, the reason sales is an art and a fantastic thing is that the best salespeople don't seem salesy. At the end, the person who bought for them thanks them for selling it to them. And they feel fantastic when they leave, because sales is a transference of feeling, and sales is helping people to buy something they already want and you already know that they need. Just helping them feel comfortable with it. So we present price. Now, we just had our first date. Isn't that fantastic? And pretty much you already know you're getting married. It's years to screw up now. Trial close. Present broad range and get a time frame. I treat email patients like they're live patients. We have templates set up. If you need to talk with me afterwards, I'll be at the booths or shoot me an email. I'm just john@fhrps.com. Frank, Harold, Roger, Paul, Sam, or come grab me. But I can talk to you guys about templates. We set up templates. Everything's pre-written. We tailor everything and personalize it. But if you ever find that you're sending like a new intro email to a patient and typing stuff, you're way too late. You should be personalizing something that's already pre-written and amazing. So we do that. We treat every email patient the same way. Our initial emails include a broad range in price. They include an asking for the order, AFTO, ask for the order. It's what we always do. Is there being a showman and a salesman. Show people, like, would you like to try my pizza? Salespeople, like, would you like to try my pizza? You like it? Would you like to buy my pizza? We ask for the order all the time. And we do it in a polite and positive way. And at the end of the email, we say, also, out of curiosity, let us know if you'd like to visit us for a consultation. And also give us some idea of your time frame. Should you like Dr. Epstein? Should you like his team? Please let us know. So deal with email patients the same way you deal with everybody else. Have the second or third emails include more specifics on price. And if you get to a fourth or fifth email, I mean, at that point, you probably should be on the phone with them and you should ask them for their phone number. Proper consultation order. Once they get into the office, the sale's already made, so now it's just doing everything in the right order. You guys need to have a patient advisor, a patient consultant, whatever you want to call it, doing your consultations. I understand that some doctors, when they're new, do it all themselves. I respect the doctor I work for who does great business, did his own consults for a certain period of time. But as soon as you can feasibly afford it, this is a place you want to invest in. The quality people is very, very important. We talked about that an hour or two ago. Build rapport right away. First thing I walk in is I build rapport and I insulate. Who's the last person they want to see? Me. Who are they going to see? Me. Who are they going to love in 20 minutes? Me. But what I have to do first, let them know the doctor's coming. So it's, hi Barbara, how are you doing? It's a pleasure to meet you. I'm John, how's everything going? Doc's coming in just a couple minutes, got to do a little paperwork, ask you a few questions. Insulated. Walls down, guards down, doctor's coming, this guy's cool. What are their goals? I find those out. We shouldn't be telling them what they need. We should find out what they need. We explain the procedure in ridiculous detail. They buy more because you told them the worst case scenarios than because you told them how great it's going to come out. Because they believe you're honest. And then we trial close again. And we say, great, you've got all the details on the procedure. Before I get Dr. Epstein to come in and meet with you, I know we spoke a little bit over the phone. You still feel like sometime in the next month or two is kind of when you're thinking of maybe, probably? And I re-ask again. Great, and as I mentioned, I think you already know from our conversation, like I said, you're going to be in that range of like 5 to 12, but more often than not 6 to 8 for this procedure. And that includes your IV sedation, your operating fees, and all the other, bells and whistles. So is that still comfortable, still thinking over the next month or two? And again, if they're saying yes, we know that we can close at the end. And sometimes they'll say, well, to be honest, John, my dog lost its job, and my husband, said I can't buy anything, and I was going to buy it anyway, but then all my money just lit on fire. At least we know, and as I'll talk about, we don't have to close this hard at the end. We get the doctor gives his recommendation in standard form, we go back in, although we should be in there the whole time. The doctor is, in my opinion, taking notes into Nextech and other proprietary software. And then we go back in and we present price and we schedule. Now scheduling at this point, guys, it's just scheduling. It's not even presenting price. It's not even asking for the order. The sale is made by this time. There's really two types of customers at this point, right? Yes, I'm looking for generally pretty soon, or I have some urgency in the next few months. We've built urgency, which is a separate topic as well. And we say to them, great, well, I know that you said you're looking over the next 4 to 6 weeks. I know that I already mentioned to you our schedule does fill up quite a bit in advance, and I mentioned the price would be around $7,000 to $9,000, and your price is, in fact, $7,900. So, assuming you want to go ahead and schedule then, just need to collect your deposit and pick a date for you. Are you thinking July 5th or more like July 9th? We ask a question of which, not if. 2 choices, not one. If you ask for one, it's a yes or no. If you ask for 2, it's a which, not if. So we present price and we schedule with confidence. We just look them in the eye. And the reason we're confident here is because we know they're ready to schedule. If they already told us they're not going to schedule and they're not interested, not right now, we can feel comfortable saying, look, I know that you probably said you were looking for more like a year or two from now, which is fantastic. And we can build some urgency and let them know prices are going up January 1st, 2013. And on the off chance they can get in before that New Year's price increase, that'd be a benefit to them. And we can still do some things to build urgency, gain referrals, and leave things positive so they don't feel like they were closed or sold or all those kind of negative terminology words, because we already know enough about our customer that we don't have to make them feel that way because they weren't buying anyway. Wrapping up quickly because we're out of time. Present price with confidence. If you're trying to sell right now, it's too late. If you're uncomfortable, kick yourself in the teeth. It's hard to do, but if you lift the leg just right. The sale was made a while ago. All you need to do is smile, present price, and wait for an answer. Think positive and act as if. Every email is just like a live call. Treat it just as preciously. Treat every call like it was a live consultation, because the sale is made there. I know it's counterintuitive, but the proof's in the pudding if you come look at our office numbers, and our other office numbers, and our other office numbers. Treat every consultation like it's a definite sale. Follow the outline, not the exact words. You don't have to be me, I'm a goofball. I think that works for me. Roxy in our office is a teddy bear. Ed is a people pleaser. Dan is smooth and quiet. But follow the outline, not the exact words. Think about the psychology, not the exact words. Be urgent, be confident, and the sale's already made.